do not ask what your country can do for you, but what you can do for your country. Without an embedded mentorship, you cannot succeed. Be authentic, do not fear the future, and seize the moment.
Hi everyone, welcome back to OncoDaily. Today it's a great honor and pleasure for me to welcome Her Excellency Martine Deprez, Minister of Health and Social Security of Luxembourg.
Good morning.
Good morning. I'd like to start from your early days. How did your journey into public service ultimately lead you to the role of minister?
Afterwards, I think you discovered the different stages who led you through this job. But at the beginning, I never imagined becoming a minister. So I started in the party I belonged to, the Luxembourg People's Party, the CSV, in 1986, while I was still a student at high school. And after finishing my degree in mathematics, I joined the General Inspectorate of Social Security. And there I worked 10 years long. When my third child arrived, I decided to give up this job and to join education as a mathematics teacher. And after my kids had grown up, I was offered a place in the State Council, the sort of second chamber in Luxembourg, which puts advice in laws and regulations. And that I did as part-time, parallel to my teacher job. And so in 2023, when the government was built, the Prime Minister had an appointment with me and offered me the job as Minister of Health and Social Security because of my experience I had before. But it was never planned to be.
And how it was to get this offer from the Prime Minister?
My first reaction was that I didn't understand that it was an offer as minister. I thought he would engage me in his government as a counselor or something like that. And when I discovered that it was for the minister, took a deep breath and I said, I asked him why he thought that I could do this job. And he reflected with me my past life. And afterwards I said I had one day to answer, and I said yes. So it was very challenging at the beginning because I had no experience in leading an administration. But after 2 years, I think I'm fine, and I now understand how to work as head of an administration and to be able to motivate, to engage people in one vision.
Wonderful. Since becoming the Minister of Health and Social Security, what do you consider your major achievements and what remains most challenging for you?
I mentioned already the leading of an administration, but that is not very political. So politically, it was the debate on pension scheme, which we took over 1 year. Yeah, we started in October 24 and we finished now in December 25 with a law that puts in several changes to assure that you have 4 more years to put in bigger reforms. And that was the main achievement during the 2 first years. And besides, I had meetings with all the parties, all the stakeholders of the health system in Luxembourg. And now we are on the way to achieve something in the health system. We already strengthened prevention. We already strengthened some hospitals, but there's a lot to do.
So if we revisit this conversation in 2 years, what concrete changes would tell you that you succeeded?
There I have a nice sentence to read that I wrote during the weekend. I think to measure success would be the realization that the day a parent no longer worries about finding a doctor for their child, the sick person no longer has to wait too long for care, and a newcomer in this country immediately knows where to turn. That's when I think that our system has succeeded.
Minister Deprez, how can the European Union move from coordination to real added value in healthcare while respecting national sovereignty? It's a bit political question,
A
right?
really, really founded question, because nowadays health systems are of the competence of the countries, and EU plays a role of coordination between bodies, and also in prevention. It gives guidelines in prevention, for instance, in the European Cancer Plan. And we fully support all EU initiatives in prevention. But Luxembourg also is a small country, and we do not be able to provide specialized care in all domains. So we are really reliant on collaborations with our neighbors, France, Germany, Belgium, and at the medical point, not only medical surgeons, but medicines supply, we really rely on joint procurement in the EU.
How would you characterize the current situation of cancer care in Luxembourg in diagnosis, treatment, screening, access, equity, and patient outcomes?
That would be a subject to discuss during hours. I try to put it in a nutshell. We have a national cancer plan, which starts with a good diagnosis, a good psychological accompaniment in diagnosis, including patients who already have their diagnosis, and that leading through treatment and through recovery. That's our big national cancer plan with the three emphasizes: diagnosis, treatment, and recovery. And at all stages, we want to include patients, and patients who are nowadays patients and patients who have recovered, to give their experience. And in this plan, we have several more actions. The first one is a lung cancer network. So we have national coordination in treatment of cancers, specialized cancers, and at each hospital you have multidisciplinary teams who make also coordination of the cancer treatment in the hospital. Then we have the Institut National du Cancer, National Institute for Cancer, which has strong collaboration with the European Cancer Net. We have a very joint action of personal cancer medicine, which is being developed, and the Right to Be Forgotten Convention, which will be put in a legal framework soonly. And then the Collective Cancer Survey, which is taken in place also in Luxembourg. And last but not least, we have put in place a recognition of genetic counselor profession. And we give every support we can for cancer screening program. So beginning with breast cancer, colorectal cancer, and now we will put in place lung cancer prevention.
Minister Deprez, I would like to stop. You mentioned one, all of them, of course, are critically important. But one thing I think it's very particular for the EU, several countries who are kind of championing this initiative, Right to Be Forgotten. And this is a critically important, I think, field. And since you are also leading both the health and social welfare, social affairs, what's the difficult part for moving this forward? Because, in many countries all over the world, people are for speaking about the diagnosis, treatment, etc. But this is also such an important issue that people who conquered cancer, they need to have the right to be forgotten. How you are championing this in your country? And what kind of challenges you are facing?
We had already a convention between insurance companies, banks, and the government to put it in place for several cancers, the right to be forgotten, but at a limited level. And that was only a convention which could be altered every day. And now we will put it in a legal framework and extend also the period to be forgotten. So I think there we can show other countries how to do it. And besides, we maintained the platform to exchange about the need to include other sicknesses, other kind of cancers, other kind of chronic diseases. So we build on exchange between the stakeholders. So insurance, banks, concerned people, and the government.
I mean, what's the current situation of smoking in Luxembourg? And I know you are having some issues and you have some recipes also for solving that.
I don't know if I have some recipes, but at our place, we have put in an yearly based a survey of consumer habitudes in tobacco. And we nowadays see that young people still do smoke, but they do not smoke traditional products. They have switched to untraditional products, the so-called new tobacco products. And that will be an emphasis for the next years to deal with. And therefore, we strengthened our law. For instance, the snus without tobacco, the snus only containing nicotine, the pochette, we call it the puffs, will be prohibited indirectly because we have lowered the nicotine content that level that they will be no longer produced in countries. And we hope that with all our prevention methods, young children will become more early convinced that tobacco is not a solution and that nicotine products neither are a solution for dealing with everyday life. We have this survey, the new one coming out in May, and we will put in place a new strategy of prevention afterwards.
One question, I mean, I think it's very relevant for EU with the open borders. I mean, if the policy is not unified or it's not the same in several countries, are you experiencing difficulties as a result of different or various regulations in EU member states regarding tobacco?
Not directly, but indirectly, because here we have the Foundation for Cancer, who puts strong emphasis on rising prices, on forbidding consumption in several places where it is not yet forbidden. And our neighbor countries behave somewhat the same. In France, they forbid it now in public areas. In Belgium, the nicotine pochettes are forbidden. In Germany, they are somewhat behind. And we are a small aisle between those three big players. And naturally, the price is one item which is being discussed at the EU level. And the taxation does not be in my field of competence. And so we have there a small, friction between finance and health prevention, because international studies show that a rise in price would have as an effect lower consumption. But taxes are filled in at the EU level where there is unanimity. And so if 1, 2, 3 countries do not want to higher their prices, this would remain a subject for next year.
So another question is, what is your vision for the future of cancer care in Luxembourg, but also for the EU?
But because of the EU, we have contact with 3 countries that already put in place the prevention in lung cancer field. And there we can rely on their experience to do it in Luxembourg. Then we have 2 joint action, the European Network of Comprehensive Cancer Centers and JANE2, the Network of Expertise on Cancer, which we are very fond of being part of it. And then the Luxembourg pilot of Comprehensive Cancer Center is put in place since March 25. So we are strong, as I said already, we strongly rely on EU initiatives as a small country.
As a small country, what the role of small countries like Luxembourg can have in the global oncology space, in innovation, clinical trials, data sharing, or policy experimentation?
Yes, we have few resources, but and that's the point in collaborating with other bigger countries. And as small countries, we have a smaller pathways, so we can experience something at a small level, which other ones have bigger pathways to put in place. And there we are sort of a small expert for bigger players. And we can link sectors more rapidly. We can put into the pathways patients more rapidly because our government, our decision makers are very close to the field. And so we can put in place small initiatives which can enlighten bigger initiatives.
So kind of the small countries also can start championing, at least piloting things,
Yeah.
and which later on can be kind of replicated in the larger countries, right?
Yeah. I appreciate being part also of the small countries initiatives at WHO, and there we see that small countries have really a small item, small experiences, and if we put small countries all together, that makes a bigger country, and we can enlighten experiences at higher level.
Talking about the global health, a lot going on right now in the global health. What you would do, to make the things better on the global health field?
Global
right
health,
to keep the
over.
word collaborating and multilateral.
For me, it's important to show that the small country is not alone. A small country has something to say. And I experienced this as a mental health ambassador at EU level, because if you talk about mental health and you show concrete realization in your country, the others listen, the others show their example, and by sharing best practices, we can really make it a whole of society movement.
Then how do you see the relationships between health policy and social protection evolving, especially in the context of cancer, aging populations, and chronic diseases?
That was a bigger issue at my starting in the ministry, because the 2 ministries were separated. There was one ministry for social security and one ministry for health. And so by putting the 2 together, we joined the whole life of a person. A person is born, is being cared of by his family. Afterwards, he works. He pays contribution. According to the contribution paid, he's given benefits. But the benefits are not only contribution related, are also social status related. And by putting the 2 fields together, we created a comprehensive attitude to see the person as a bigger picture in his social life. And we put in place social security coverage for everybody, in the sense that also people who do not have a work can be assured on a voluntary basis or on a basis of being taken in charge by NGOs. So every person present on the Luxembourgish country, on the Luxembourg country, can take care of himself and can be taken in charge by hospitals, by the health community.
Thanks. Minister Deprez, who have been your mentors and what kind of influence they had on your path?
There were many. First, my parents. My parents guided me through society and showed me how to care for other people, because they were also always very attentive to other people, how to say, problems. They were problem solvers and did not seek problems. So that was an attitude I was given since I was a child. And it was my mother who took the party member cards. So she pushed me into the party. And afterwards, in the party, I listened to people who had experience. And there were two personalities who really pushed me. That was Mark Spotz, nowadays Minister for Labour, and Michel Volta, who put in place the pension reform in the civil servants administration. And those two still support me. And as they supported me, I want to support youngers who will start in the party, who will start their political life, because without an embedded mentorship, you cannot succeed.
You are a believer in youth, young people?
I'm a believer in youth. I was a teacher, and since my children grown up and as my life as a teacher, I believe always in youth. And that's why I put also the younger generation in the discussion of the pension schemes. And we will continue to discuss for the next 3 years.
Then what would be your advice for a younger generation?
Be authentic, do not fear the future, and seize the moment.
Then one question I think I missed over there. You mentioned that you merged the two ministries.
Yeah.
In your opinion, is it the right decision? And would you recommend other countries to do the same?
I highly recommend it, because the money you pays the health system has to be well taken account of. You cannot separate the collection of the money and the allowance of the money. So you have to put the two together. And everybody who's working in the system nowadays cannot imagine to be separated again. And international studies also confirm that it has put in our system on a stronger basis than it was before.
Thank you so much. Is there anything else you would like to share before I'll ask my last question?
In my preparation, you asked which book I would recommend.
Oh, yes. I missed somehow that. Sorry.
No problem. You're welcome.
That's a great question. Which book you would recommend everyone to read?
That was also a big reflection I had to do yesterday. And finally, I choose The Little Prince, Le Petit Prince, d'Antoine de Saint-Exupéry, because of a really good lesson of humility, humanism, and what is really important for life for me is to take the time to care, not only to care for yourself, but also to care for others.
Thank you so much. It's my favorite one as well.
Okay.
Yes.
Thank you.
Especially when the how it starts with the hat, which actually is not a hat but the snake.
For the phrase I would address to younger people, I have also forgotten one sentence, one quote that moves me in my life is the one of Kennedy, who said, do not ask what your country can do for you, but what you can do for your country. That moved me since years.
Wonderful. Right now I have it in a small how it's called, magnet in front of me.
Yeah.
with
So
7.
the class and the Code of Kennedy we have in common.
Yeah. Thank you so much. It was really wonderful. And my last question, which I usually like to ask everyone I have an honor to interview, why should interview next?
I told you that I want to be the mentor of younger people, and we have 2 younger deputies who started their deputy life recently in 23. That is Françoise Kemp, who now become the president of the Commission for Social Security and Health, and Ricardo Marquez, who shares with me my strong belief in mental health.
That's wonderful. With great pleasure. I'm going to contact them and
Thank
say
you.
that the minister suggested to interview you.
You're welcome.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.